Good morning. My name is Mihiraa. Can you say your name for the record, please?
Good morning, Mike. My name is Shane Nicholson.
And what is your candidate number, please?
My candidate number is 211146450.
Thank you. And you are taking this test as a doctor. Is that correct?
Yes. Correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed, and it is a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What steps do you take to prevent medical errors?
I take my job very seriously, and so I do my best to get a broad understanding of the symptoms through communication with my patients, examinations, and further testing. I feel that it is also helpful to consult with other physicians, in cases where I am not certain of treatment, and I am careful to refer patients to specialists for matters outside of the typical scope of my practice.
What skills did you pick up during your pre-medical education that will help you thrive in the medical field?
During my pre-med education, I truly honed my organizational, time management, and planning skills. While I had developed those capabilities prior to heading to college, the challenges associated with the pre-med workload meant I had to refine them. I created an organizational strategy, combining assignment lists and study schedules, that allowed me to track important activities. As a result, I never missed a due date, and was able to spread out my studying and adjust it when specific courses had tests on the horizon, making it more manageable and highly adaptable.
How do you hope to make a difference as a medical professional?
As a medical professional, I hope to make a difference by making healthcare more accessible to underserved communities. I intend to find opportunities to volunteer in community health clinics, particularly in areas where poverty makes even basic care unaffordable. Ideally, if the area I'm in doesn't have a free clinic, I'd like to open one, ensuring everyone has a place to turn when they are in medical need.
What made you decide to become a doctor?
Initially, I was focused on biochemistry. My goal was to enter the pharmaceuticals field, allowing me to develop medications or treatments that would improve the lives of people in the throes of an illness or dealing with chronic conditions. However, as I pursued my education, I discovered that I preferred the more personal connection. Communicating with individuals, understanding their unique perspectives, and searching for ways to ensure they could live their best life became equally important. By becoming a doctor, I could make a difference on a personal level. Plus, my biochemistry background uniquely positions me to understand the pharmaceutical industry in a different way, ensuring I can guide patients more effectively while working with them to achieve their goals.
What motivates you?
Making a difference in the lives of patients and their families motivates me to be the best tech I can be. Making patients comfortable and helping them through a difficult visit is what I look forward to. I became a phlebotomist because most people have had blood tests, and a good tech makes the difference in patients coming back regularly. I'm interested in your position as I feel like I excel at the pediatric population.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play cards if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Preparation time is over. You can now start the role play. Don't worry if I stop you when the time is up.
Good morning. I'm Dr. Shane Nicholson, one of the doctors in the clinic. May I know your name, please?
Hi, good morning, doctor. My name is Mihiraa.
Hi, Mike. May I know the reason why you are here?
I am really under tremendous stress, doctor. I would like to get rid of this.
Oh, I see. May I know the reason for your stress? Do you have any health issues that bother you?
I got divorced recently, and that's stressing me out. I don't have any other health issues.
Well, I understand your concern, Mike. But, I am afraid, I am not the correct doctor to treat you. I suggest you to consult a psychologist, and I can arrange it for you. May I?
I know it, doctor. Actually, I'm here to get a medical certificate from you.
I think you told me you had no other health concerns. May I know, for what concern, I shall issue you a medical certificate, and for what purpose, please?
I think it would be better for me to have a 2-week holiday from work to recover. But, my boss refused my request for vacation leave. Kindly issue a medical certificate that will allow me to have 2 weeks off from work.
Sorry, Mike. Since you have no health issues, I cannot issue you a medical certificate for stress alone.
Why can't you issue a medical certificate for stress management? Stress is an illness, and I'm entitled to take sick leave.
In cases where stress interferes with your health, or, as in cases of depression, a medical certificate can be issued. But in your case, you have no health issues, for which I can issue a medical certificate. I am sorry.
If you can issue a medical certificate for depression, it is okay for me. What I need is a medical certificate for a 2-week holiday, doctor.
It is so unfortunate to hear such a request from a person like you, Mike. Issuing a deliberately false or misleading certificate represents professional misconduct. I'm not ready to do anything unethical.
No, doctor. I don't mean anything like that. A really good holiday can make me feel better.
Mike, I think you should talk about your stress to your employer. I am sure he will understand. Misuse of sick leave is a serious matter that cannot be justified. It may even cost you your job.
Please, doctor, try to understand my intention and situation.
Mike, going on vacation by pretending to be sick might have serious consequences, and your boss can question the medical certificate.
I don't think the boss will question the medical certificate. Even if he did so, it is true that stress will affect one's health adversely, isn't it true, doctor?
Mike, I acknowledge that stress affects health adversely. I advise you to consult a psychologist for stress management, rather than going for a shorter relief.
I don't think I have serious psychological issues, doctor. It's just a matter of shock from the incident.
Going for a vacation is a temporary solution for your stress. And it will not have a longer effect.
Oh. It might be, doctor. But I wish to have a vacation.
Mike, I can assure you that a psychologist can help you much better. Consulting a psychologist will have a greater effect on the long-term benefits.
Okay. I will think about it, doctor.
Great to hear that, Mike. I am sure a psychologist can guide you better than me. You will be convinced once you meet him.
All right. I think it is a considerable advice, doctor.
I'm glad to hear that, Mike. So, can I make an appointment, please?
Yes, sure, doctor.
Thank you, Mike. Appointment details will be informed to you from the clinic.
Thank you, doctor.
You are very welcome. I wish you a happy and stress-free life ahead.
That is the end of your OET speaking roleplay. Thank you and all the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.